Joining us now is Dr. Daniel Amen, founder and CEO of Amen Clinics and the author of Your Brain is Always Listening. Dr. Amen, it's great to have you back here at Faith Nation. As you just heard today, that exchange between Dr. Fauci and Senator Rand Paul, Dr. Fauci conceded that there needs to be an investigation into the possible laboratory origins of the virus. Dr. Amen, how significant is that? And then also, how necessary would that investigation be?
Well, it's very necessary. If we don't do everything we can to understand the origin of the virus, what's to say it won't happen again next year or 5 years from now? This has affected people not only physically, but as a psychiatrist, what we saw last year is depression tripled. We're in the middle of a mental health pandemic caused by COVID-19, and we have to be diligent in understanding where it came from so that we can work to prevent further pandemics.
So why are we just now, getting around to this? It seems like, things are finally lifting. We're seeing really the world open up again. Why are we just now talking about this investigation and where it all originated from? Is this a little too late, or what's your thought on that?
Well, people have been speculating, trying to investigate it from the moment it started. We all wish things were different than they were. But there have been a lot of voices for let's understand this. The idea that it came from the wet market, it just didn't fit for a lot of people. There've been a lot of skeptics all the way along. The unfortunate thing is it became political, and then people started taking sides, and we lost our rational judgment with the politicization. I actually talk to a lot of my patients about ANTS, automatic negative thoughts, the thoughts that come into your mind automatically and ruin your day. And we've just been infested as a society with the division, the hatred. I've gone through 10 presidential elections as a psychiatrist. I have never seen one that damaged my patients. Whether, they're on the left or on the right, the level of family discord is just historic. I've never seen anything like that. We have to get back to more rational thinking and investigating where this comes from. Of course we should. That's just a rational scientific question that people should be asking with great fervor.
I'm going to borrow from you, Dr. Amen, about getting rid of that ant infestation. Lastly, we only have about a minute left. The COVID-19 vaccine has, of course, as you know, been approved for emergency use with children ages 12 to 15. Dr. Amen, since children tend to fare better with the disease than adults, should parents be hesitant?
Well, children can still get COVID-19. They can still be hurt by COVID-19. And more importantly, they can still spread it. This is not an innocuous virus. I had one of my 28-year-old employees in our Manhattan clinic end up on a ventilator for 10 weeks. I lost my dad to this virus. Mm-hmm. It's not a joke. It's serious. And this pandemic has hurt so many people economically, physically. The grief and lost dragon, I talk about it in Your Brain is Always Listening. Along with the death dragon, they're living in the minds of our children. The vaccine's been tested on thousands of children, shown to be safe for most. Of course, if you have a child with medical conditions, you should talk to your doctor. But I think it gives people a level of freedom knowing that they can take COVID-19 and sort of turn it into a cold. That's what the vaccine does.
Dr. Amen, unfortunately, we're out of time. Thank you so much for your insights and for being here.
It's great to have you.
Thank you.